Welcome back to the Healing Wellness Show. I'm your host, Dr. Karim, and today we're diving into a fascinating and rapidly evolving area of regenerative medicine, and that's stem cells. You've probably seen headlines, maybe even heard stories of athletes or patients getting remarkable results with stem cell therapy. But what's the science? What's the hype? And what's real? So to guide us through this today, I actually have a special guest today, Dr. Sammy. He's down in Texas. He's an expert in stem cell therapy and regenerative medicine. But we're going to unpack the science and the safety and also the future in the field of stem cells and what that could mean for your health and healing. But yeah, I'll be collaborating with Dr. Sammy about how we also use our stem cells in our clinics as well. But Dr. Sammy, welcome to the show. For the
Thank you.
listeners that haven't heard about you, why don't you give us a little introduction there?
Thank you, Dr. Karim. And yes, I'm Dr. Sammy Hardin with H2 Wellness Solutions down in McKinney, Texas. We've been working with stem cells for the past, since 2016. I'm a chiropractor by trade. So we have a medical team that does our stem cell therapy here at the clinic or concierge service where we go to other doctors' offices and do it for them as well.
Excellent. Excellent. Why don't you elaborate real quick about the medical team? Who's in your medical team?
Of course, the laws are different in every state about how, who, what, and when, and you can do stem cells. So here in the state of Texas, we have a oversight over our nurse practitioner, and we also have RNs that'll go out and do the therapies for us.
Great, excellent. In Iowa, I actually have a nurse practitioner that does that for us. So yeah, like you said, every state does have their own regulations. But Dr. Sammy, why don't you tell our listeners the science, the background, what exactly are stem cells and why are they so unique?
Okay, well, stem cells are the body's natural repair component. It's what actually repairs the body. So suppose you cut yourself, you cut your arm. It's the stem cells that your body produces in the bone marrow that go to that area and correct the damaged tissue. That's what repairs the damage. And pretty much in a nutshell.
Okay. So are there different types of stem cells that you would say out there?
There's different sources of stem cells out there, like there's amniotic fluid stem cells, which is basically the fluid around the baby during pregnancy. They extract the stem cells there, try and clean them up the best they can, and they use those to inject into people's joints. They also have Wharton's gelin, where they take the umbilical cord itself, grind it up into a mush, and use that as well to inject into people's joints. And then they're also using your body's own stem cells and calling it plasma-rich protein, where they extract your blood, spin it down, and then they can put that either back in your bloodstream or into the joints. What we prefer to use is the blood of the umbilical cord because it's highly concentrated with stem cells, living stem cells. And of course, the way our lab processes them, they go back into your bloodstream, they come back to life. So suppose we put, say, 10 million stem cells in you today. Tomorrow, that 10 million is now 20 million. The next day, 40 million. So each day it doubles in number.
And is there regulations for that? Like, hey, the umbilical cord that they're getting, is there specific rules in order to harvest the stem cells?
Well, of course, you got to have the permission of the parents to collect the umbilical cord. But what our lab does, it collects the umbilical cords from local labor and deliveries here in the DFW area, where the parents fill out a full medical questionnaire, so we know all about their medical history, the medications, the vaccines, family illnesses, et cetera, et cetera. And then when our lab picks up the umbilical cord, they take it back to the lab and they run 14 to 17 different disease tests on it before they even extract the stem cells.
Yeah, and that's kind of the same process for us. I mean, there are criteria. It has to be a healthy mom, healthy baby.
Yes.
It has to be a C-section. It can't be natural birth because vaginal wall can compress on the cord, or you can get vaginal diseases on the cord. And it can't be aborted babies because with abortion, you can damage in that cord. So it has to be a C-section. And mom has to agree to donate the umbilical cord. If mom agrees to donate it, then the stem cell company takes it, does extensive testing on it, make sure there's no diseases whatsoever. So it sounds like it's the same process, which is excellent. So that's really where you really need to know, like the labs you're getting it from, but also, well, how much are you getting in your body as well?
Well, yeah, that, and you want to make sure they're safe as well. And not sure if you knew this, but suppose you needed a blood transfusion. Blood banks only run 7 to 9 different disease tests on that blood before they put it in your body. So I think it's important that our stem cells, we go above and beyond what's even required by that because we want it to be safe for our patients.
Yeah, for sure. For sure. Well, Doc, what kinds of conditions or injuries are you seeing stem cell therapy used for?
Oh, well, of course, the normal aches and pains, neck pain, back pain, bulging disc, herniated disc. What we've seen, and surprisingly, with our stem cells is if we do, say, we treat a lower back pain, all right, and all of a sudden now this patient no longer has, or uh, no longer is having trouble with their COPD, or they've been able to reduce their insulin for their diabetes, or asthma's gone. We're currently working with a Parkinson's patient that's been confined to a wheelchair for the past 10 years. And he's undergone 3 rounds so far. But after the first round, he was able to, with assistance, his family picking him up and helping him walk around, which he hadn't been able to do for the past 2 years. And then after the 90 days, we did another round on him, and he was wanting to show off for us. So he actually stood up out of his wheelchair by himself and is using the walker at home. So
Wow.
those are the surprising, I guess, side effects that we've really been happy with as far as our stem cell therapy.
And how are you administering the stem cells?
Ours, we prefer to put in the bloodstream. Okay, the way the lab describes it to us, once we put them into the bloodstream, they come back to life. So the stem cells that we put in today, at the end of the 6 months, their life cycle, we now have 400 billion brand new stem cells flowing throughout the body, as well as 800 signaling cells flowing throughout the body.
And are you using that same protocol for all types, whether it's say diabetes, heart disease, autoimmune conditions, joint pain, or are you doing different protocols for those?
Nope. We just put it all into the bloodstream. And what the stem cells will do is seek out inflammation. They seek out inflammation because that's, I guess you could say that's their food source. So once they go to the inflammation, they're correcting the damaged tissue that created the inflammation. And those stem cells are now becoming that tissue, whether it's heart, lung, liver, spleen, kidney cells, or muscle, ligaments, and tendons.
Well, basically, what you're saying is it attaches to the worst areas in the body first.
Exactly. Yep. It'll always prioritize life over the aches and pains.
Yeah. Yeah. That's exactly what we say too. So, Doc, why don't you kind of walk us through, a patient comes in your office, is asking about stem cells. How do you explain the process from like a consultation all the way to the treatment?
Well, of course, we start out with what is it that they would like to get out of the therapy, and then exactly what are stem cells, what do they do? The body's natural repair component, and just of course, anytime we are talking or consulting with a patient, it's important to understand these stem cells are not curing any of these diseases. They're not curing Parkinson's, heart disease, all that stuff. All it's doing is making the body stronger than the disease, so you're not really suffering the symptoms of your disease. Now, when it comes to the aches and pains, usually it's one and done if it's done correctly. So we educate the patients on that. We do x-rays before and after so that we show them the results, see the results, but majority of the time, it's the way they're feeling is the results.
And then are you using any other modalities while you're doing the stem cells, or is there anything else that you're doing in conjunction with the stem cells?
Yeah, being a chiropractor at trade, what we do is since we put the stem cells in and it's to repair the damaged tissue, we continue the chiropractic care to make sure, if their spine is off to the side, we're doing the chiropractic to realign the spine so that it's healing or repairing itself correctly so that things don't go back to where they were. And we also use code laser therapy, which helps us, since we're putting the stem cells in the bloodstream, we use the code laser therapy to help us direct it to maybe their shoulder, their knee, their back, their neck, whatever it is that they were wanting the stem cells to focus on.
So with a patient, what are realistic expectations? And like for them, how, some of them will ask, hey, how soon might I feel results, or what outcomes are, might be supported by evidence?
Yeah. Well, unfortunately, everybody's different. Sometimes we see immediate results. Other times it may take 6 to 9 months, but I've seen them work all the way up to a full year before we have to go in and do another dose.
So what do you say to patients who are skeptical or fearful about trying stem cells?
It's got to do your research. It's know your source, where the stem cells are coming from, how they were processed. And as far as skepticism, seeing's believing. We've testimonials. We use just patient interaction as far as with their results, et cetera, et cetera. But it's a tough nut to sell.
Well, there's a lot of confusion out there nowadays.
Yeah.
But what would you say are some of the biggest myths or misconceptions about stem cells?
The biggest myth is, stem cells also grow cancer cells. Well, that's not the case. You got the right lab, they extract all that. The stem cells go after healthy tissue. Stem cells don't produce inflammation. It's the body trying to get rid of the cancer cells that's creating the inflammation, trying to flush it out, trying to repair the damage.
Any other myths or misconceptions?
Wow.
I'll tell you, like in our clinic, we get quite a bit and that's why, education is crucial. Is a lot of them think that they're coming from aborted babies.
Yes, that is
but I mean, that's never the case, especially with stem cell companies that do have relationships with specific hospitals, and you have to have the mom, be able to donate it or say, yes, I'm going to donate. They can't just steal it or take it without consent.
Yeah, and that is very true. Yeah, we do not. It's against my belief as well that aborted babies should not be sacrificed for the better well-being of another human being.
Yeah, exactly. Well, are there any risks with stem cell therapy?
Well, in our clinic, we've had zero adverse reaction. If it depends on about the medium. What I mean by the medium, the suspension that the stem cells are in. A lot of companies are using DMSO, which is sulfur. And anytime sulfur is injected to a person that is allergic to sulfur, there's usually some sort of adverse reaction. However, 90% of the time, it is more of a itch, funny feeling, a funny taste in their mouth, that sort of reaction versus full anaphylactic shock is very rare. Our lab does not use DMSO, so we've had zero adverse reaction, and they've been using the same medium for the past 5 years with, again, not just in my clinic, but company-wide, zero adverse reaction.
Yeah. Yep. Same thing with us. We've never seen one side effect from stem cells. And that's why we're able to use stem cells actually right now is the FDA regulates it, but it's not approved. So basically, because it does so much, with FDA, usually they want to say, okay, you're going to use stem cells just for heart conditions or just for brain conditions, or, this is doing everything in the body. So it's not honed down to one thing, but it is regulated. And that's why we're able to use it, because there isn't one side effect from stem cells themselves.
There is one source of stem cells that I prefer to stay far away from, and that would be the amniotic fluid stem cells. When you think about where the stem cells are coming from, which is the amniotic fluid, you just can't clean poop out of poop. That's why they have a higher rate of adverse reaction versus the Wharton's jelly, the PRP, or even the umbilical cord stem cells.
Yeah, for sure. So we've all heard clinics out there making bold claims. How can patients protect themselves from misinformation or unsafe practices?
That's kind of hard for me to answer because I haven't come across any of the bad companies out there that are just lying and deceiving people, though they are out there. Again, these stem cells, it doesn't matter what source they're coming from, it is not a cure. It just helps the body be stronger than the disease or the aches and pains. Now, when it comes to orthopedic issues like back pain, shoulder pain, stuff like that, again, it's usually one and done if it's done correctly with the right mediums or the therapies to make sure the body repairs itself correctly and not incorrectly that created the problem to begin with. I don't know if any of that makes sense.
Yeah, I typically will educate the patient and tell them, hey, you need to be the advocate for yourself.
Exactly.
Ask the right questions, because a lot of times they don't know what questions to ask. I usually will tell them, hey, ask what lab it's coming from and research that lab, or ask how many, million or billion are you actually getting? Because some places it's, hey, you're just getting a few thousand. Well, that's not really stem cells. Usually stem cells are in the billions and sometimes in the millions if you're using your own. But these are some of the things that, we tell patients that are kind of hesitant or asking about these things is, hey, do your own research, find out the labs. Usually for every sample, there's actually a paper that comes with it that tells you that it got tested, that how much is in there. So those are usually with the clinics when they administer it. So you actually have the right to get that piece of paper, tell you about your own stem cells are going into your body as
Yeah,
well.
I believe it's called the white paper or the
Yeah,
white report. Yeah.
yeah, for sure. So, Doc, so just like looking ahead, 5, let's say 10 years down the road, where do you see stem cell therapy heading?
Oh, I'd love to see it go mainstream. Again with zero side effects and um, 90 to 95% improvement. I definitely see it being the wave of the future. If it's not, and it is here. I mean, it's already, um, people are seeing great results. Science will continue to tweak it and make it better. And yeah, it's just going to continue to get better and better as the years go on. And the more we use it, the more we can learn from it and the better future that we'll have with the stem cells.
What breakthroughs are you most excited about?
What I've been seeing with illnesses. We've got kidney failure patients that no longer need their dialysis. Now, it didn't cure their kidney failure. All it did was make their body stronger than the disease to the point they don't need dialysis. My dad recently went through liver failure, stage 4 liver failure, and they even went as far as putting him on the transplant list. But they were trying to get all of his liver enzymes back down to normal using chemotherapy and all this other stuff that wasn't working. Within a couple of weeks of us giving him stem cells, his blood work came back to normal, has been normal for the past 6 months. So we're continuing to monitor his blood work. And if his blood work begins to change, we're just going to hit him with more stem cells and see if we can maintain and keep his liver failure at bay. And so he can continue to live a nice, healthy life.
Nice.
And I'm not ready to let him go.
Yeah, that's awesome story there.
Thank you.
Any other success stories that you're willing to share with us?
We could talk. My mom, of course, against my advice, got peer pressured into doing the COVID vaccine. I don't know if we want to get into that or go there, but as protocol, within 2 weeks, my dad woke up next to her. She was completely unresponsive. They put her in the hospital. This was back when they allowed no visitors. Well, luckily, they did not have any ventilators to put her on. So back the protocol was build up the O2 sat and send them home. Well, we put stem cells in her, and within 12 hours, she sounded like my mom. Anyway, she's back to normal, living life fully, and 0 side effects. And yeah, she's the strongest she's ever been.
That's an amazing story. That's really powerful. So if someone's listening and is interested in stem cell therapy, what should be their first step?
Well, do your research. Okay. Talk to the different providers that are out there and listen to their testimonials and their patients. And if seems right for you, then get them done.
Well, thank you, Doc. Thanks for sharing all the wisdom with us today. Anything else that you would like to share with our listeners?
Just, I don't know, help me out here. Give me something to get safe. All right. Never give up. There's always something out there that is going to work for you. Hoping that stem cells will be your answer. Falling into the normal traditional medical protocol. Just do your research and do what's right for you.
Yeah, I always say just be your own advocate. If you're hearing something that you're not liking, then I always say continue shopping.
Yeah,
don't just settle for one answer. Just continue searching what's best for you.
And definitely know your source of stem cells and its track record.
Yeah. So Doc, what really got you into stem cells? Why did you, pick up on stem cells and decide to have it in your clinic?
Okay. All right. Well, a little bit of background about me is I was a paramedic for 15 years. So I'm fully diverse in medicine, how they do things, mainly emergency medicine. But doing what I was doing, I started working inside an emergency room, following medical doctors around. Of course, we're taught to believe, they could walk on water, this and that. But it got to where every doctor was doing the same thing over and over again. I thought, you know what? I could do this. So got to talking to some of the doctors I did respect and asked them if they had it to do all over again, what would they do? And I had a couple of them tell me they'd be chiropractors. So I applied for med school in chiropractic at the age of 35 and decided whichever one calls me first is the one I'm going to go. And to prove that the big guy in the sky has a plan for us, chiropractic called first. Being a chiropractor for as long as I'd been a chiropractor, doing research, came across a video of Mel Gibson talking about his dad that had stem cells done. And I thought, you know what, let's look into this a little bit. But at the time I was looking into it, I was having to refer patients out to other doctors that were doing stem cells. And problem with that was I had no control over the source, what they were getting, how they were getting, or even how much they were being charged, which was ridiculous at that time. And then once the laws changed where I could hire a medical team to come in and do our therapies for us, that gave us more control over the good stuff and being able to control the cost so that more people would be able to do the stem cells themselves. So that's kind of how I got into the whole routine. I wanted
That's
patients
awesome.
to get better.
Yeah, thanks for doing that. So, Dr. Sammy, just real quick question. Why do you think stem cells aren't being advertised out or talked about as much? They're kind of like in the hush hush. What's your opinion on that?
Well, the biggest thing, and it kind of upsets me every time I hear that it's an experimental therapy. Science has been experimenting with stem cells since the 1950s, so they know what it is that they can do. I still don't have a full understanding why it's not out there. I guess in my own personal opinion, I think it's pharmaceutical companies are scared of, because if my stem cells can get you off dialysis, or our stem cells can get you off your insulin for your diabetes, it's kind of hitting them where it hurts. So I think a lot of the misleading information out there comes from pharmaceutical companies just trying to protect their industry.
And that's awesome. Dr. Sammy, I'd like to thank you so much for sharing your expertise with us today. Why don't you tell everybody where you're at?
H2 Wellness Solution, McKinney, Texas. Phone numbers 972-548-2225. You can also reach us on our website, h2wellnesssolutions.com.
All right. Well, thank you so much, Doc, for sharing your expertise with us today. And, stem cell therapy is an exciting frontier. But as we've heard, it's important to separate fact from fiction and look for evidence-based approaches.
Yeah.
So for our listeners, if you found today's episode insightful, well, make sure to subscribe to the Healing Wellness Show on Spotify, Apple Podcasts, or wherever you're listening to. And don't forget to follow us on social media for more tips, stories, and expert conversations just like this one. Well, until next time, I'm Dr. Karim. Stay healthy, stay informed, and keep moving towards your best life.